Thanks, Kim. My name is Margie Gale, and I will be providing the cost analysis of the Remote Patient Monitoring Program. But first, let me share some statistics with you. Dealing with increasing healthcare costs is a major concern for Americans today. Costs for chronic health conditions have increased over time for patients as well as insurance providers and healthcare organizations. Of the 318 million people in the United States, 133 million have chronic health conditions. One of the most prevalent conditions affecting approximately 84 million people is cardiovascular disease. Included in the classification of cardiovascular disease are heart attacks, strokes, and congestive heart failure, which is when the heart cannot pump enough blood and oxygen to support other organs in the body. Congestive heart failure affects 5.7 million adults in the United States. Let's pause for a moment to talk about our population and monitoring factors. According to the American Heart Association, in the United States, heart failure is among the leading cause of hospitalization of adults age 65 and older. Within that population, 22 to 24% will be rehospitalized within 30 days for the same condition. Often, constant monitoring may have alleviated the need for a return trip to the hospital. Additionally, the average cost for readmission for congestive heart failure is $6,762 per patient. When you do the math, that adds up very quickly. This cost of readmission is absorbed by healthcare organizations as they are not billable to insurance companies when a patient is readmitted for the same diagnoses within 30 days of their initial hospitalization. With cardiovascular disease being the most prevalent chronic health condition among Americans and affecting 84 million people, it is easy to understand why health systems like yours are looking at this and saying, what can I do to reduce my readmission rates? So let's take a look at the cost savings opportunities for deploying the Remote Patient Monitoring Program and the benefits associated with it. The average cost of implementing the Remote Patient Monitoring Program is $1,200 per patient per year. The benefits are numerous, foremost being the immediate care patients will receive due to consistently being monitored. If an issue is detected, immediate care can be administered through a phone call or other medical assistance, which is projected to reduce readmission rates to 10%. One nurse can monitor 125 patients remotely in a week compared to the 40 patients cared for with home health care visits. Remote monitoring saves time, both the nurses and patients, increases patients' comfort levels, and increases nurse capacity by 3 times for maximum effectiveness. The readmission rate cost savings of over $6,700 per patient could potentially yield a $3.2 billion savings overall for healthcare organizations using this program. Now I'd like to turn the presentation over to Derek to cover our data description and preparation processes in more detail.